Class is now starting. All attendees are in listen-only mode.
Hello and welcome to the 47th Bi-Monthly Breastfeeding Coalition's webinar. I am Kinkini Banerjee, the Coalition's Relations Manager at USBC, and I'm so glad to have you join us for this session. This webinar series is jointly hosted by CDC's Division of Nutrition and Physical Activity and by USBC. The webinars, referred to as the 222, are held on the second Tuesdays of even-numbered months from 2 to 3 p.m. Eastern. And the purpose of this series is to bring together breastfeeding coalitions to share best practices and news and to network and collaborate on issues of national significance. We alternate the sessions, so we bring you one webinar with a national focus followed by one that highlights the state successes. Last time we had a terrific session on the Listening to Mothers survey by Childbirth Connection. Coalition members and breastfeeding advocates can join us for the national webinars. The announcements are sent through the USBC's Coalition's announcement list. If you're not already on our mailing list, you could go to the quick links section on the right side of our homepage and sign up on the News and Alerts action button to join our mailing list. This national webinar will be followed by regional call. For those participating in the regional calls, you will need to dial your state's call-in telephone number. Your state's designated contributors manage the call lines for your coalition. I'll go over some logistical details for the webinar today. All our presentation handouts and video recordings of this and past sessions can be found on the Coalition webinar page. You will have that information either on your confirmation email that you got, or you could go to the quick links section on our web page, and you'll see on the fourth item there is the bi-monthly Coalition's webinar, and if you click on that, it will take you to the webinar page. For today's session, all attendees are in listen-only mode. I can hear an echo from me. I wonder if any of the other panelists have their phones unmuted. Okay. Hopefully all the other phones are muted. So for today's session, all attendees are in listen-only mode. And we set about 10 minutes for Q&A at the end of the presentation. So you can type your questions into the question box at any time, and here's how you do it. So on the right side of your screen, you should see a control panel. In case you don't see it, it might be minimized. Click on the orange tab and it'll pop right back out. And if you scroll down to the audio, just below the audio section, you'll see a blue tab with questions. And when you click on it, it'll open up a box for you to type in. During this session, if you have any audio problems or technical issues, send an email to office@breastfeeding.org and someone should be able to help you. And that brings me to today's session. The title is called Continuity of Care in Kansas, the Story of a Community. As you may know, the Best Fed Beginnings is a nationwide initiative to make quality improvements to maternity care practices, supported by CDC funding and led by the National Initiative for Child Health Quality, or NICHQ, in partnership with Baby Friendly USA. This project is helping hospitals in 29 states use the evidence-based practices of the 10 steps to achieve baby-friendly designation. The USBC has been involved in this project in the continuity of care connections area, working with state and some local community breastfeeding coalitions to develop systems to advance the continuity of lactation support between hospitals, outpatient healthcare settings, and community settings, specifically to support the implementation of steps 3 and 10. Breastfeeding Coalition members and hospital staff in 29 states have been working together this past year to build and strengthen community connections, mapping existing resources within the hospital catchment areas, identifying community gaps, and working to strengthen connections and create new continuity of care resources to provide moms and babies the support they need to successfully breastfeed and to help increase exclusivity and duration of breastfeeding. Today we will hear the story of Kansas, how Wesley Medical Center, a large maternity care hospital in Wichita, Kansas, formed a diverse and energetic local community team, which, with the assistance of the Kansas Breastfeeding Coalition, has made a significant impact on the continuity of breastfeeding care being provided in the community. I am thrilled to present today's presenters. Our first presenter is Catherine Walker. Kathy is the team lead for the Best Fed Beginnings project at Wesley. She is the lactation services manager at the hospital, where she coordinates inpatient breastfeeding support services and the breastfeeding clinic. She has been a pediatric clinic nurse specialist for over 20 years and is a past president of the Kansas Breastfeeding Coalition. In 2005, Kathy co-wrote the bill that eventually became the Kansas law protecting a woman's right to breastfeed in public. She advocated tirelessly with a dedicated group of volunteers from around the state to finally pass the bill through the Kansas legislature in 2006. Our second presenter is Jolyn Dowling. Jo is an IBCLC and has worked for 17 years in a Level 3 NICU. She is now a faculty member at the Wichita State University School of Nursing. Jo's clinical work as a neonatal nurse practitioner included critical care for newborns and for newborns and families, and critical care newborn transport with LifeWatch and management of complex lactation issues. This expertise has evolved into an involvement with establishing community connections to reduce the impact of infant mortality. Jo serves as the key contact for the continuity of care connections, helping between the hospital and the coalition. Our third presenter is Melody Ward. And Melody is an IBCLC and a La Leche League leader. She's the fifth generation of breastfeeding women on her mother's side of the family. So we can safely say that breastfeeding is the norm in Melody's family. She has worked in hospitals, in WIC, and is currently involved in a number of initiatives, including the Kansas High Five for Moms and Babies Breastfeeding Work Group. She's also a past president of the Kansas Breastfeeding Coalition. And our final presenter is Brenda Bandy. Brenda is an IBCLC and a founding member and past president of the Kansas Breastfeeding Coalition. She serves as the La Leche League rep to the USBC and is also the alternate coalition regional rep for the Mountain Plains region. Brenda is co-chair of the 2014 National Breastfeeding Coalitions Conference and also chairs the advocacy committee at USBC. She is the program director for the Kansas Breastfeeding Business Case for Breastfeeding and also administers the Kansas Breastfeeding Coalition's Child Care Provider Education Program to improve their support of breastfeeding families. And with that, I'm now going to turn it over to our first presenter, and that is Jolyn.
Hi, this is Kathy. Actually, I'll be the first presenter, and I am just thrilled today to be able to share with all of you about our baby-friendly journey at Wesley Medical Center here in Wichita, and also the important role that our community team has played in our journey. Next slide, please. Actually, go down 2 slides. Okay, well, the slides aren't advancing, so I guess I will, okay, there we are. As a little background, Wichita is the largest city in Kansas. Wesley Medical Center is a large teaching hospital, a 760-bed acute care hospital, and we do 6,400 deliveries per year. That is the most of any hospital in Kansas, plus a multi-state area around us, so we are known as the baby hospital. We were chosen in 2012 to participate in the Best Fed Beginnings project. Next slide. Okay, and now one more slide. And as we already learned, the Breastfed Beginnings Project involved 90 hospitals nationwide. We were one of those hospitals that was chosen. And what we do as a Breastfed Beginnings hospital is implement the 10 steps to successful breastfeeding and work toward baby-friendly. What we looked at when we had our hospital team that got together to plan that whole process, we decided that the job was so big that we needed to split up into work groups. So we formed a work group around each of the 10 steps. And one of those work groups that we formed was our community work group, and that was formed back in August of 2012. Now, my background, I'm currently a pediatric clinical nurse specialist in a hospital setting, but I began as a public health nurse, and I was a public health nurse for 15 years in a small health department. A part of that, all of that, I worked in WIC, but part of that also, I worked in a program where I visited the local hospital daily and did visits on new moms and babies there in the hospital and also in the home. So for me, the partnership between hospitals and the community is very natural, very comfortable, and I wanted to get that community team together as soon as possible. So the partners that we included in our team that you might think about if you want to do the same thing: hospital personnel. We do have staff nurses and some of our lactation consultants. We have physicians and nurse managers. We have WIC, the local WIC office, our WIC supervisor, and some of the people involved with WIC. Obviously mothers, and I started mothers because if you don't have mothers on your team, you're probably not going to be very effective. Low-level leaders. Healthy Babies is a new parent support program in our community, but you probably have something similar like Early Head Start, Healthy Families, Healthy Start, state and local breastfeeding coalition leaders, and then we have some private practice IBCLCs and a couple of professors from Wichita State University. Then on last year in 2013, we received the Continuity of Care grant from USBC. And one of our professors from Wichita State, Joe Lynn Dowling, moved into a leadership role with our community team. Next slide, please. So if you're a person that's in the community and you are wanting to reach out to the hospital, I have some ideas for that, but we also, okay, somehow I skipped another slide. I apologize. What we did for our work group, we assisted the hospital with implementing steps 3 and 10. So step 3 is the prenatal care, prenatal education. Step 10 is discharge support. And so with those 2 steps, we, as I said, moved into the Continuity of Care project. So if you are a person that's in a hospital setting and you're wanting to convince your hospital to be part of the community team, move to the next slide, please. You can talk about the value to the hospital. Team members provided us with needed perspective and insight and acted as liaisons to their individual community groups. So it's really helpful to keep those lines of communication open. We identified community needs and resources, and Joe Lynn will be talking about that in a minute. Another really important thing for me is that those team members, those community team members were cheerleaders for us as we were working as a hospital staff. So often I would have those people that were very enthusiastic about breastfeeding support would pat me on the back and say, great job, and I just really needed that. So that was valuable. And then having moms and families involved, that reminds us of why we're doing this, and it puts a human face on the quality improvement project. Next slide, please. Okay, so if you are a community person and you want to get a hospital involved, I wrote down some things that I thought might be helpful to you. Hospitals are increasingly interested in providing quality breastfeeding support. I think we all have heard about the Joint Commission perinatal core measures, steps 5 and 5A, and so there are some hospitals that are Joint Commission certified that are reporting those data now on exclusive breast milk feeding, but we've just recently been told from CMS that they are going to start using our breastfeeding statistics to help determine reimbursements for hospitals, and that's coming in 2017. So that's going to be really important and a way to really motivate hospitals to be interested in working on breastfeeding. So if you're in the community and you want to reach out to a hospital, you can try calling the lactation consultant phone line or the office in the maternity area. You might ask your pediatrician or obstetrician for an introduction, or you can ask them who in the hospital you would want to talk with. Introduce yourself at breastfeeding conferences or community events, and be sure to let the hospital know that you're available to help. And if you have some very specific suggestions on how you'll help, that would be very motivating to them. Next slide, please. So lessons that we learned, be sure to send invitations well in advance because everybody's very busy, and when you do those last minute things, people don't come. Have a central location, somewhere that's easy for people to get. And if you're meeting in the hospital and you're wanting to get hospital staff involved, you might consider finding a place there in the actual hospital to meet to see if you can get more of the staff to be able to be there. Consider those with small children. We've really run into this with our moms. Think about the time of day, the time of year. What I mean by that is in the summer, we have a hard time getting moms to come because they have all their school-age kids at home and child care issues. So think about what can be done for that. Provide food if you can. Have a job for everyone to do. That is so important. If you come to a meeting and you leave feeling like you've wasted your time or you didn't really accomplish anything, there are many people that will never come back. But again, don't have too big a job for them to do, because if you do, they may just decide it's overwhelming or too much work. And this last one is really important. Make sure everyone at the table is ready and willing to treat everyone else with respect and attention. We found particularly there are some people that are apt to maybe look down on other people, and just want to make sure that when you're putting together that particular meeting, you want to have people that will be supportive and respectful to everyone. Now I'm going to hand off to JoLynn.
Thank you, Kathy. So what Kathy has already explained is, so next slide please, what was in place, and that was that we had a community work group through the Best Fed Beginnings already developed. We had community partners around the table with various professional expertise, but with one vision in mind, and that was to advocate for breastfeeding support and continuity between the hospital and the community. I was thrilled to be asked and given the opportunity to serve as key contact as a liaison between this community work group and working with Kathy in the hospital. And an advantage to me was that I had also been a former employee of Wesley Medical Center, so I had a little bit of knowledge base already in place for me to know kind of the protocol, policies, and systems that were in place in the hospital. Also, like I said, we had a common vision, but we were very blessed because we had a community coalition, our Maternal Infant Health Coalition here in Sedgwick County, that had recently conducted a community assessment of maternal infant resource services in our Wichita area. And so this assessment and asset map had already been developed, and our faculty members had, and other team members actually that were a part of this work group, had also participated with the Maternal Infant Health Coalition, and so we obtained permission to actually use their resource list as a foundation to get us started. Next slide, please. So on this next slide, you will notice I have just inserted the community asset map that just gives you an idea. For those of you who work in public health, hopefully you have seen this type of map for different services that might have been assessed in your community. But this is very helpful because you see the red cluster of dots are maternal infant services that seem to be clustered in the central location of Wichita. However, it is very sparse as you extend out to the outer borders of our catchment area. So that can kind of guide you in where you might need to target some of your resource allocation. And so this is just something to show you. Most public health departments have this type of expertise to be able to develop maps as you begin your resource assessments. Next slide, please. Another other things that were in place were that the community partners that were around the table, for example, the Leche League and also our Sedgwick County WIC department, had prenatal and postpartum education and support information already in place, and they were able to provide their resources in addition to this Maternal Infant Health Coalition resource list. And then I want to give credit, and I also want to praise the United States Breastfeeding Committee for having a wonderful toolkit already in place. When we were awarded the grant to begin the Continuity of Care Connections project, they had a toolkit that had wonderful tools to begin our assessment, to develop our project, and work with them. So I appreciated that they had that toolkit in place to help facilitate the process. Next slide, please. So what we determined might need to be done was that we needed to refocus our group mission and get more specific to develop resource assessment plan and also meet our contract deliverables. And those were determined by the work group as well. We also needed to look at collating the multiple resource lists into one document, and then to determine, are there community partners that need to be represented to be able to provide their expertise and resource knowledge that may not be currently sitting around the table. And think outside of the box. This could be your city council representatives. You have a health board within your city, those types of members that may not be sitting at the table, but that you do want to contact and maybe invite to be present and participate. Next slide, please. So our team process, when I first thought about how we might proceed with this, I always think education. When you bring a group together, it's very helpful if you can first describe, what is the purpose of the project, what kind of objectives do you have. What I wanted to make sure that the group, because I had already been a member of the work group, even though I was a key contact, how did my role change, or how was it going to augment our process, as well as what materials were provided by the United States Breastfeeding Committee to facilitate the project. So bringing everybody on board so they were aware of what the project was about and what kind of tools we had available to be able to facilitate the process. We also wanted to review the existing resources, like I said, to be able to look at all of the resource lists that we had available, and then determine which ones were current and which ones needed to be deleted. We know those of us that have worked in public health know that funding can make or break an agency. You may have an agency that provides support services and educational services to a specific population, such as breastfeeding mothers, but then because of funding they go away. So we wanted to make sure that our list was current. Next slide, please. We also wanted to make sure that we invited community partners of particularly areas that might be vulnerable but also maybe underrepresented, such as our military base. We have a large Air Force base here within the Wichita community, as well as our Black Nurses Association, to help with some of the vulnerable populations that we have high infant mortality rate. We also then determined that we needed to develop an action plan specific to assess the prenatal and postpartum breastfeeding, educate, and support services that were provided by our community. By collating the community resources together, what we needed to do was to populate the community dashboard. What that essentially was is a spreadsheet that we could put all of the resources across the top, and then we could evaluate specific education and support services that they provided. Also, we felt we needed to develop a script, because some people are more comfortable speaking in public than others. Some people are more comfortable approaching agencies that they may not be familiar with. If they have the script to follow, then you're not only helping the comfort level of a person that's going out and asking the questions, but you're also ensuring that the content of the questions is consistent. And so that helped our team to be able to facilitate the assessment process, and then to determine deadlines for our action items. We, as a group, decided that we needed to meet monthly if we could, and then we utilized email communication between meetings to facilitate the project. The next slide, please. Because some of the challenges, as previously mentioned by Kathy, is that the period of our implementation was during the summer months, and we knew there was a short time for the deliverables, and so that online communication helped facilitate the process. So how did we divide up the work? Next slide, please. We had, through our review of the resource list and collation of those community resources, we had the final comprehensive list completed by early July 2013, and that included the name of contact person for the resources, the phone number, email, and a website if any of that information was known. Then what I did was I collated all of that, and I populated the community dashboard, emailed that to all of the members so they had that information, and then they volunteered who they would contact. And as I said in my email, many hands make light work, and when you have a large group of community partners willing to engage in the process, we had 33 resources that we identified, and if you have 5 group members that are willing to contact, or 6 or more resources, then that's not too big of a chunk to take on. We had approximately 2 weeks to be able to complete that process. Now I'll hand it off to Melody to have her share her experience.
Thank you, Joe. I appreciate that, and I welcome the opportunity to be a part of this webinar today, and just tell you a little bit about, I was one of the worker bees, so kind of what it was like from my perspective. After we received the community resource list from Joe, then we all decided, the team members chose who and how many members that they were going to contact. And some were done by phone calls, and some were email inquiries. I think that most of them were done by phone. And out of the 12 that I chose, 8 were doulas, and I was only able to reach 10 of them. But what I found was interesting in the process was that all those that I spoke with were all very open to sharing how they were encouraging and educating and or supporting moms with regard to breastfeeding, and they were receptive to partnering with us in the future or distributing literature that we would provide for them. A couple of the resources stated that they would need further information that they or one of our team members could present to their superiors or to their board of directors before they could agree to partnering. So that gave us a little task to do. One of the most interesting contact experiences that I had was with Choices Medical Clinic here in Wichita. And the head nurse invited me to the clinic to visit with her and the staff, as well as take a tour so that I could see firsthand how they operate. She pointed out, interestingly, that the clinic is located right next door to the abortion clinic in Wichita. The staff I found at Choices was very kind and committed and dedicated to helping moms and families during a very difficult time in their lives. Their services that they offer are free to moms. One of their services is to offer a sonogram of their unborn baby to the mother as often as she wants one. And quite clearly, their main focus is not breastfeeding, it is preventing abortions. However, they encourage breastfeeding, and as you can see on the slide, this is a pamphlet that they give to every mother that comes into the clinic. It's a pamphlet by Heritage House, and the information is at the bottom if anybody's interested in it. The head nurse was really open to providing up-to-date evidence-based breastfeeding information as well as partnering after she got board approval. So I just wanted to share that experience with you. I really enjoyed that part of the process, and I'm really looking forward to following up with each of these resources and providing them with the information packets that we've developed. So we'll hand it back over to Joe now. Next slide, please.
And so part of the process needs to be evaluating the resources. After we had contacted and populated our spreadsheet with the information, we then rated each of our community resources as far as the level of breastfeeding support and education they might provide, with 1 being the least and 5 being the most. And that was a ranking system that the USBC had provided to us. And that helped us to determine where we had our community assets and then where we needed to fill the gap. Next slide, please. And so this next slide identifies the priority action items that were determined by our group. We felt like we needed to develop some more materials to provide education that's consistent with baby friendly and the care to expect at Wesley Medical Center. We wanted to develop a toolkit to be able to provide to our resources, as well as collaborate with the state coalition and Sedgwick County to provide an electronic link to be able to link them up with our resource assets. And then part of that would be to, as you know, we've got to keep up with technology. We thought that a QR code would be kind of a nice way to do that. And then to translate the materials into Spanish. Next slide, please. And so I really want to express that what went well was that we had already team members that were engaged and committed to the project. We also had mutual trust and accountability among team members. We accepted the process as adaptive, and what I mean by that is that, you know, we knew that the end goal, what our end goal was. You see the image of the yellow brick road there. There's lots of windy paths that a journey can take when you're developing systems within a community. But to keep the goal in sight and to realize that sometimes A plus B doesn't equal C, to appreciate the gifts that everyone brings to the table. And we did not work in our own silos. We worked with each other and among each other collaboratively to achieve our end results. So some of the challenges are identified on the next slide. I think what our development of the What to Expect card, which I believe is going to be provided to you today by the USBC, was probably the most challenging. We all had input into that, and we used the Kansas High Five for Mom and Baby as an example. Some of the things that were challenging were to not provide too much information on the card. We wanted to make sure that it was at a very low grade reading level, like a 5th to 8th grade reading level, and also what kind of format, dual-sided or trifold, what would work best. Reviewing the websites took some time. Also, the process to develop the QR code, we did not have expertise in how to do that, and so then to try and figure out how that would be done. And then some of the professional and personal obligations that we had with our own, our primary responsibilities were to our employment, and so to be able to dedicate the time committed to this project in addition to our regular professional jobs was sometimes a challenge. So the next steps, where we are now, the Kansas Breastfeeding Coalition has our resource assets, and they are developing a URL link on our state website to be able to then link up through a QR code those resource assets for our community. And then we also have a translation pending. Once we have a little more tweaking to do on our materials we've developed, and once that's finalized, we will send that to be translated. So now we begin our phase 3, which is our deployment, which is to take our toolkit, which I've identified on the next slide, from resources that had already been developed by the Sedgwick County Health Department, as well as the resources our committee developed, and take that to the community, and then also try and reach those gaps within the African American community and also the military community to establish peer support to be able to provide additional breastfeeding support and education to our community moms and provide those continuity links. So Brenda, on to you.
Thank you. Thank you, Jolynn and Kathy and Melody. This is Brenda Bandy, and I'm the program director for the Kansas Breastfeeding Coalition. And that was a lovely description of one community in Kansas, our largest community, Wichita, and their journey in connecting community resources to provide support for breastfeeding. And I'd like to take the remaining minutes that we have together to describe to you our vision in Kansas for communities throughout our state to support breastfeeding. The next slide, please. This is our vision of 6 programs that we currently have here in Kansas, how they all impact mothers and babies with breastfeeding support. And we really believe that while each program can provide a lifeline of support in one area of a mother's life, But when it's woven together, there's really synergy there that creates a net of support through which we hope no mother or baby falls. So I'm going to be referring to this net of support as kind of a visual for our goal. We are going to be weaving together these 6 programs to strengthen and provide something that any one or 2 of the programs alone couldn't provide. Next slide, please. The first part we're going to be looking at is societal support, which is our Breastfeeding Welcome Here program. And this is modeled after many other states. There's probably several of you on the phone, lots of you on the phone, who are familiar with state programs that allow businesses with public accommodations to recognize themselves as welcoming public breastfeeding in their location. We modeled our program after Tennessee, a little bit of Texas, Indiana, and we came up with this logo. And we currently have 64 businesses participating around the state. But what's interesting is that when businesses are approached, usually by a local breastfeeding coalition, some of them have even gone on to be award winners for another program that I'm going to mention in a few minutes, which is our Business Case for Breastfeeding, recognizing employers who have modeled support for their breastfeeding employees. So these 2 programs often complement each other. Next slide, please. The next program that we're extremely proud of here in Kansas is our Building Local Breastfeeding Coalitions project. And I have to give a big bow to Tina Cardarelli, who helped us get started back in November of 2012. We received a grant from the Kansas Health Foundation to get us started. What we realized is that most of this work is done on the local level. And at that time, we only had 8 local breastfeeding coalitions in our state. So we brought Tina in, and with her help, we had 84 participants come for one day, representing 34 communities. And after that summit in November 2012, we have since gone on to grow to 18 local breastfeeding coalitions around our state. And we support these coalitions and continue to foster new ones through quarterly conference calls, frequent email contacts. There's a lot of exchange of information that goes on between local advocates and our state breastfeeding coalition. And we're really proud to say that we're going to be hosting a coalitions conference September 26th in Wichita, and it'll be modeled very closely upon the National Breastfeeding Coalitions Conference, which is coming up here in August in D.C. We're going to be trying to replicate that on a state level and support our local coalitions and hopefully foster and grow new ones. Next slide, please. You'll see from the theme here on our slide that we really consider Indiana kind of our big sister, and they have helped us quite a bit with several of our projects. And this is another one, getting child care providers to be supportive of breastfeeding and more knowledgeable about how to support breastfeeding. And again, Tina was very generous to provide a lot of their materials and their training program. We've gone on to partner with some statewide agencies to offer this training program online. And we offer it for free because I moderate the course, and the programs like Kansas Child Care Training Opportunities actually host the program on their online server. So it's a great partnership. We have educated over 300 child care providers in the state. And the great thing is the providers, as part of their training, one of the exercises they have to do is to identify local breastfeeding support. So we're pointing them towards hospital clinics, towards their WIC peer counselors, to their La Leche League groups. And oftentimes they're unaware of some of these local breastfeeding resources. So again, weaving this net of support together where we get child care providers aware of where they can send mothers for more information when they need additional help and support. Next slide, please. The other program that we have in place to help, as you know, a big barrier for most moms is returning to work. And so we have what I think of as the granddaddy of our programs, which is the Federal Business Case for Breastfeeding program, which we received the federal grant from HRSA back in 2009, but we received additional funding to expand and enhance that starting in 2011. And this has allowed us to really do what I consider a grassroots to treetop approach to helping mothers and communities. We've gone into local communities, specifically where those coalitions are, but even elsewhere, to train local breastfeeding advocates in how to talk to businesses. Many of you familiar with the toolkit know the premise there of how to talk the language of business as well as what the federal law says. But we've also then gone on the state level to do presentations to chapters for the local Society for Human Resource Managers, Chamber of Commerce, Kiwanis clubs. We've talked to lots of large business organizations to make the work of those local advocates even easier, because the business owners will have heard about this from many different ways. We continue to give awards to businesses and recognize them, and we also point them back to that first program I mentioned, the Breastfeeding Welcome Here. So these programs you can see kind of weave in and out and together and really complement each other well. Next slide, please. The next program, the Maternity Care Program, is our Kansas High Five for Mom and Baby. And this one is unique of all the ones that I'm talking about today because it is not administered by the Kansas Breastfeeding Coalition. It is administered by the United Methodist Health Ministry Fund. However, everyone on our board serves, I think almost everybody on our board serves on their advisory committee. So we work very closely together. And it's modeled after the Colorado Can Do 5. Most of you are probably familiar with these types of programs that help hospitals to adopt and implement 5 of the 10 steps for the 10 steps to successful breastfeeding. And so we're really proud of our High Five program, where we have over half of our maternity care hospitals in Kansas enrolled in this program. And so that just actually rolled out, I think, about 2 years ago or so. So we're really excited. We do not have any baby-friendly hospitals in Kansas. Wesley and Wichita, that you heard Kathy talk about, will be our first. So we're very excited about that. Next slide, please. This is the last one. We're going to talk about peer support, which we think is extremely important in this net of support to which mothers and babies will not fall. We work very closely with La Leche League of Kansas. We're blessed to have so many trained leaders in our state. We also have a lot of peer counselors through WIC, and we have several support groups that are actually hosted from their county health departments. And part of the program through the Kansas Breastfeeding Coalition is we've actually provided a 1-hour training through Kansas Train, which is a free online training program where anyone can go to this program and get free training on how to start a breastfeeding support group in their community. And it goes through all the details of location and who should facilitate it and so forth. So we're really proud to say that we're going to be increasing access to peer support in Kansas through this additional training. So all of these things we're hoping to weave together to provide that really strong community support here in Kansas. And I think we will move on to questions then, since we are out of time.
Great. Thank you, Kansas. It truly takes a village. And this is just such a great session, listening to the breakthroughs and challenges and lessons learned from Kansas's team journey. So I am going to turn it over to, we have, what was the QR code used for, was one question that came up.
The QR code is a code to be scanned that will then link the scanner, the person who is scanning the code, right into the resource assets that are within our community. So it's a quick link, if you will, to the community resources that we have identified as assets within the Wichita area. And it's in process. We're actually developing that. That's in process right now with our Kansas Breastfeeding Coalition to be housed, or the host will be our Kansas Breastfeeding Coalition website.
So the idea is that this QR code is a quick link to a web page, and that it'll be easier to keep a web page up to date and current, so that the mother connecting to that page will get the most current information. As we all know, once you print a resource guide within how long? Like a month, it's all out of date. So it's a way of making sure that the mom is always connected to an up-to-date current resource, because it's a web-based page. So that was the idea behind that. This is Brenda.
Okay. And another question says that, did you have breastfeeding peer counselors going into hospitals for support, and how has that how during your BFB project, and how have the hospitals been on board with that?
I'm sorry, this is Kathy. In Kansas, we just have the one Best at Beginnings Hospital, which is ours at Wesley. We do not have peer counselors that go into the hospital setting. Our WIC program in Kansas has not made that available to us, but we do have peer counselors in the community, and we do refer people to those.
And this is Brenda, and I know that throughout our state that there are some hospitals that have made arrangements with their county health departments for the Healthy Start home visitors to come in and visit with moms. So it's not always the WIC peer counselor. Actually, it's normally not, but it's someone else from the county health department coming in and making that contact. So they're not providing breastfeeding assistance, but they are making connections for resources for that mom and directing them to WIC if they need additional help.
Thank you. And for your business case for breastfeeding, a question about that, saying, did any of your employer partners analyze any kind of return on investment for developing a lactation support programs? And if so, do you have any of that information available to share with other coalitions and other employers?
No, we have not. To my knowledge, we have not had any business partners do a financial analysis on the return on investment. So no, I don't have that data. We do have evaluation data that shows us where employers, how they support their breastfeeding employees, written policies, location, break time, that type of information, but not the financial information.
Okay. Thank you. And another question is for Brenda, for you. Who is eligible for the free online training on how to run a breastfeeding support group? So who, this training that you have,
right.
Is it
to my knowledge, and I know that we don't have Martha here from the state health department that uploaded it, but it is free to anyone, and I believe anyone in the country. And it's through Kansas Train, T-R-A-I-N, which is an acronym, I understand. And I think many of you are probably familiar with this program because it's often a way for getting online training. And it is free, and I believe it is open to anyone. But I can clarify and send that information to Kenny to share.
Thank you. That's terrific. And there's the map of, the information resources map that you had. There was some question about how did you, what services and what did you include on that map. So you do have some templates for us and a lot of resources. So the Kansas Coalition has shared of the fruits of their labor, and a lot of these handouts and materials are on the USBC website, right?
Yes, and that resource map was not developed by us. It was developed by the Maternal Infant Health Coalition, and those resources, the red dots that are identified on that map, are maternal infant services. So anyone who provides maternal infant care, not specifically breastfeeding. So that was why we used and asked permission to use their resource list to further communicate with those resources to see what specific breastfeeding education support they might provide. That type of mapping can be done usually through your local health department.
Terrific. Okay, and we have a lot of questions, and since we're running out of question times, there was one more. How receptive were the businesses to your training on business case?
I'm sorry, this is Brenda. The businesses were receptive so long as we went to them. I found that the most successful we had in actually visiting with the employers was not cold calling or emailing. It was going to where they gathered, which was typically their monthly meetings through their SHRM chapters. SHRM is the Society for Human Resource Managers, or their Chamber of Commerce meetings. If I could get an invite to do a presentation there, that's where we really got the most bang for our buck. And that really then led to the contacts that I could follow up with to do the individual one-on-one assistance with the businesses. So I would say the SHRM chapters and the Chamber of Commerce were the best resources for us for connecting with businesses. And then they were extremely receptive once they understood and they heard kind of my 1 hour spiel on what we had to offer and why it was a good thing for them.
Terrific. Thank you. And we do have some more questions, but we have to move on. So thank you again, Kansas. It really, truly takes a village. And I hope listening to the breakthroughs and challenges and lessons learned from Kansas's team will give you all give us all some valuable ideas and strategies for partnering with other stakeholders to build, sustain, and spread improvements in maternity care practices and to make breastfeeding the norm. So as I said, there are other templates and handouts developed by the coalition and this project that will be available for our download page. And from that, we move on to the next section of our session, which is the CDC announcements. And today, Kelly Scanlon from CDC's DNPAO will update us on CDC's plan for release of the NIS breastfeeding rates. So Kelly, you are on, and I'm going to pull out your slide.
Before Kelly gets started, I'm going to start. This is Larry Grummerstrong. I'm going to start with 2 announcements and then pass it over to Kelly. The first announcement is that Dr. Benson Silverman, who was the Food and Drug Administration representative to the U.S. Breastfeeding Committee, passed away over the weekend of cardiac arrest. Just wanted to let you all know that and keep his family in your thoughts and prayers. Dr. Silverman was also the representative of the Food and Drug Administration to the Federal Breastfeeding Working Group over the last several years, and his key project has been to work on the infant formula final rule, which was released today from FDA. An interesting timing there, but if you want to see some of the new rules that FDA is putting out on the safe manufacture of infant formula, those were released by FDA today as a final rule. The second announcement went out previously in the USBC Weekly Wire, but that is about the business case for breastfeeding materials. Just a reminder that due to some new policies at the Maternal and Child Health Bureau, they cannot store those materials in their warehouse for prolonged periods of time, and those are reaching their expiration date. So if you have a need for the full kit or inserts to the kit, encourage you all to go to askhrsa.gov and order your copies of the business case for breastfeeding. Otherwise, those materials are going to be destroyed, and we will have lost taxpayer dollars for very useful materials. Let me now pass it on to Kelly to talk about the NIS rates.
Hi, and it's great to be here today. We plan to release the updated breastfeeding rates for World Breastfeeding Week as we do each year. But we have 2 important changes this year that we want you all to be aware of. If you could change slides. So each year we do release provisional rates on the breastfeeding report card and on our website. And then, as you know, we update to final rates on our website 1 year later. And with the children from an additional NIS survey year. Next slide. So what I think there's slides are not advancing. Kenny?
I have the addition of the cell phone sample. Do you see that slide?
No, we're actually, so go back a slide. We're not seeing the slide.
Oh, I see. Okay.
The title slide, Kenny.
We're on the title slide, and we should be on the one titled Final Breastfeeding Rate.
Okay. Do you see that now?
No.
Okay, hold on just a second.
I don't know if
I'm sorry, I think my slide is not showing.
And I can start talking it through in the meantime. So, as I just mentioned, each year we've been releasing the provisional rates on our report card and then updating 1 year later with an additional survey year. But one of the first announcements is that CDC will no longer report a final breastfeeding rate 1 year after the provisional rate. Our provisional rates will be our final rate. because they are no longer provisional. What we have seen is that the impact of adding the additional children in that additional survey year really has very small impact on the breastfeeding rates. Yet it does create a lot of confusion, we're aware, and so that is why we will release rates on a birth year only once. And so this August in 2014, we will release the final rates for 2010 births as well as 2011 births. Then next year in 2015, we'd only be releasing those rates for 2012. So that's, one of our updates. The other change relates to the addition of a cell phone sampling frame for the National Immunization Survey. So up until 2010, and I'm not sure if you're seeing these slides, but up until 2010, the National Immunization Survey was based on landline phone sample only. But of course, the United States has been changing in terms of the percent of children that are living in homes that no longer have a landline. And so by 2011, 38% of young children were living in homes with a cell phone service only. And so the NIS has, starting in 2011, expanded to include cell phones in terms of interviewing about breastfeeding practices and, of course, immunizations. And so we have just completed an examination of the impact that this change from a landline only to what we call a dual frame, which is landline plus cell phone respondents. We've just completed that impact on infants born in 2009 and in 2010. So rates you've seen in the past based on landline only. And in general, we've seen that the impact on national estimates for initiation of breastfeeding and exclusivity of breastfeeding have been very small, less than a 1 percentage point change in the rate. But we've seen a slightly larger change on looking at the duration of breastfeeding at 6 and 12 months. It's ranged from about 1.4 to 1.7 percentage points, always lower, consistently in one direction. So our dual frame showing a lower breastfeeding rate. And we've seen the variation has been in those rates has been greater at the state level. So we see some states having lower rates, some higher rates, but on average about over 2 percentage point change in breastfeeding rates, from about 2.6% on exclusive breastfeeding at 6 months to 3.8% on any breastfeeding. So larger changes at the state level, which we've always seen fluctuation. And I don't know if we're seeing these next slides. We just showed you some trends at the national level. Again, just showing that impact on initiation. If we're looking at these trends where we have all of our, and the solid line, all of our landline years from 2000 to 2010, you can't even see where we've added in the dual frame rates as a separate line in 2009 and 2010. On the lower two lines of any breastfeeding at 6 months and any breastfeeding at 12 months, there you can see below the smaller line in 2009, the lower breastfeeding rates for the years 2009 and 2010. And then that last slide just showed some of the changes which you cannot see when we add on the dual frame compared to the landline in 2009 and 2010 on our rates of exclusivity. And so those are the basic updates. We expect to receive the 2013 NIS breastfeeding survey data next week, so we can start the analysis of the 2011 rates that we will be putting out in the breastfeeding report card. We don't have the data yet. This is all the work we did in addition to be ready for the data so that we can release. And if you have any questions about our move to, one release of a birth year as final or the addition of the cell phone frame, we are here to answer.
Thank you, Kelly, and I hope that the others were able to see the screen because it did show that it was showing. So I do hope we do have the slides on our website as well, the CDC update slides, and as well as the video recording of this. So thank you, Larry and Kelly, and very sorry to hear of the passing of Dr. Benson. That is a shock. It's time for some quick USBC updates and to let you know that we had elections for coalition regional reps in the Southeast and Northeast region, and I'm really glad to introduce our new reps for the Southeast region. It is Heidi Agostino from Florida is the new coalition regional rep, and from Kimberly Scott from Alabama is our alternate. For the Northeast region, we are really thrilled to have Dr. Lorraine Boyd from New York State, who's our regional rep, and Chris Bracken from Connecticut is our alternate. So congratulations to our new leaders. We are very grateful to our outgoing Northeast Regional Rep, Jen Matranga, and alternate Morty Koppelman, and also to our Southeast Region Rep, Sylvia Edwards, for their years of dedicated service and for being strong voices for their states in the region and for such stellar USBC ambassadors. So the 5th National Breastfeeding Coalition's Conference is upon us, and it is from August 2 to 4 in Arlington, Virginia, as always. And we have 3 pre-conference workshop sessions on Saturday, the August 2nd. So we have one on community engagement, one on maternity care practices, and one on racial equity. These are going to be terrific sessions, and we got a record number of proposals this time. The conference program is shaping up to be great. The registrations open this week, so you should be hearing from us very soon. I also wanted to tell you about our new webinar series on the power tools for coalition, the nuts and bolts of coalition building. So we had our first session on March 26th, which has been archived. Our second was on May 14th, which has also been archived. And on July, we have a session on advocacy and lobbying for nonprofits. So just in time for you to come to August for the conference and also our advocacy day. So as you know that on the last day of the conference, that's Monday, August 4th, after that we have a day of action, and we ask all conference attendees to attend. And you know that you can attend regardless of your job. We know that we do a lot of, we'll be having a webinar also on advocacy versus lobbying and what you need to do. So thank you for all you do, and we really look forward to a terrific conference. It's now time for our regional call. So if you're one of the 5 from your state connecting to the regional call, you need to hang up from this and then go on to your regional meetings. And please do remember to fill out the evaluations for us. Thank you again for all you do, and until we meet next time in August, thank you again.